For our assessment project, we decided to take a look at the early screening inventory, which ranges from 3 to 5 years. So this is students who are in preschool and kindergarten, and this is a screening assessment. And the content areas that it assesses are speech and language, cognition, perception, and motor coordination. So this is not an IQ test or a school readiness test, but the overall purpose of this assessment is designed to identify children who may need special education services in order to perform successfully in schools. And this can determine if they have a condition that may place them at risk for school failure, and it also can determine the possibility of a learning or handicap condition that might affect the child's overall potential and success in their school. And there are two forms of this assessment. So the ESIP, which is the ESI preschool level, which is used to assess children 3 years to 4 years and 5 months. And then there's the ESIK, so the ESI kindergarten level, used to assess children from 4 years, 6 months to the end of 5 years old.
So the portion that we are going to administer of this screening is for ages 4 to 4.5, and it's block counting. So as the administrator, I'm going to place 5 blocks on construction paper, and I'm going to ask the child to count these blocks and point to each one and count out loud so that I can hear you.
1, 2, 3, 4, 5.
And if the child is able to count the 5 blocks without any assistance, then they get a 2 in that section. And if the child's not able to count the 5 blocks, I'm going to remove 2 of the blocks and ask the child to count them, pointing to each one and counting out loud so that I can hear you.
1, 2, 3.
And if they're able to do that, they get a 1 in that section, and this is all depending on the one-to-one correspondence of them counting the blocks. So in this specific portion of the screening for ages 4 to 4.5, an 18 or less means that they need a referral. A 19 to 20 means that they are going to need a rescreening in the future, and a 21 or more means that they're okay and they're on the right track. For a rescreening, it's best to enroll them in a preschool program where they have opportunities to socialize with peers and they have the ability to be exposed to new challenges, which will ultimately determine if the rescreening is necessary in the future. And if they need a referral, this means that they have issues with language, fine motor skills, perceptual and cognitive abilities. This can be because of a lack of exposure to books, conversation, or manipulatives. And it's recommended that they're enrolled in a preschool quickly. And for the referral, it should be evaluated with observations or with a more in-depth assessment by certain specialists. So with any screening or assessment, there obviously comes with advantages and disadvantages. For this specific screening, the advantages are that it's super easy to follow because of the step-by-step directions that are included, and it also encompasses a wide area of content that the child's being assessed on, and it's also really accessible. It's not something that's a whole process for an administrator to give out. It's readily available. The disadvantages is that it's really only a pass or fail scoring system, so there's not really any feedback for improvement, and it doesn't really consider external factors that may be affecting the child, whether they're having a good or bad day or family issues or anything like that. And it also doesn't offer any form of creativity. It's the administrator saying, you do this, and if you don't do it the way that I would, or the way that's intended, then you fail. So that's not really offering, diversity in that area.
So how can this assessment be used in connection with other assessments? So if a child has a diagnostic in the future, the screening is readily available for them to refer back to observe any progress or regression that the child faces. A future diagnostic will determine a child's strengths and weaknesses in this area, but this screening will help pinpoint the specific strengths and weaknesses.